I will spot myself. Good morning. Good morning. We are waiting for our attendees to join. Our numbers are going up. Okay. I think we can begin. Thank you for joining us today. Good morning. My name is Carol DeAndres. I'm with the MPA team here at the California Department of Aging. Welcome to today's Disability and Aging Community Living Advisory Committee meeting. Today's June 7th, 2023. We are meeting in this virtual space, so thank you for joining us. American Sign Language is provided. Closed captioning is available via the Zoom webinar functions. All meeting materials and the recording will be posted on the Cal HHS DACLAC webpage. We ask all committee members, if they haven't already, please rename yourself in Zoom by hovering over the 3 dots. They will be in the upper right of your video display, and then select rename, type in your own name so we know who has joined us today. If you're having trouble with that, please just chat me and we can work through that and get that done. We will be taking public comment later in the agenda. Attendees joining by webinar can use the Q&A function to ask a question, or select the raised hand icon and we will announce your name and unmute your line. Attendees joining by phone will press *9 on the dial pad to raise your hand, and then we will announce your last 4 digits of your phone number and unmute your line. And of course, you can email your public comment at any time to the engaged email box, which is engage@aging.ca.gov. So that concludes our housekeeping for today. Now I'd like to turn over today's meeting to the Director of the California Department of Aging, Susan DeMorris. Good morning, Susan.
Thank you so much, Carol. Good morning to everyone, and Erica, our ASL interpreter. Welcome to everybody. It's great to be here today. We are in June. Can you believe it's June? And we are celebrating Pride Month, World Elder Abuse Awareness Month, Alzheimer's and Brain Awareness Month. Later this month, June 22nd, is the anniversary of the Olmstead decision, the foundation of this very committee. And I'm just so happy when you think of the Olmstead decision and the opportunity for everyone to live in the setting of choice that we're talking today so much about housing, the setting of choice. It's also budget month. I think everybody on this call knows that too well. I want to thank all of you for your individual and collective advocacy on the budget. We'll be seeing the results, within days, weeks. We never know how that timeline goes, but overall, we're pleased that there were no direct cuts to the programs we all care so deeply about. There is potential for extensions on some of the home and community-based services initiatives. We'll wait to see how that all shakes out in the end. And we're just thrilled about the governor and the legislature's investment in older adult behavioral health. This is an extension of the Master Plan for Aging, and we often say that the Master Plan is a whole of government approach. So I want to thank and welcome all of our state partners who are joining us today. This is absolutely a whole of government approach, whether it's the Department of Rehabilitation, Department of Developmental Services, Department of Social Services, Department of Healthcare Services, and others in the California Health and Human Services Agency. In addition, our partner agencies. Today, we're just thrilled that we'll be joined by representatives from the Business Consumer Services and Housing Agency. I believe Tani will be with us today. And let's see, what else do we want to talk about? Can we advance to the next slide to see what we've got there? All right. We know that in the Master Plan for Aging 2023-2024 initiatives, the 95 new initiatives that were released this January, that we categorized by analyze, deliver, and communicate. And I just wanted to lift up some of the things we've delivered on since we last met with you. Yesterday, so many familiar faces from the webinar on the Home and Community-Based Services Gap Analysis and Roadmap Initiative. Thank you all for joining yesterday and for being part of that work, and continue to stay close to that work. We're really excited about what's happening with our No Wrong Door governance model and our links to the Aging and Disability Resource Connections. I mentioned already, the culmination of so many people on this call and others' work to elevate mental health, older adult behavioral health, and to prioritize that. We're so grateful to the Mental Health Services Oversight and Accountability Commission for the grants they awarded in April, for everyone who turned out for the roundtables in Fresno, Ukiah, San Bernardino, and San Francisco. The $50 million proposed, we'll see where that lands. Thank you to everyone who has worked so hard on the Bridge to Recovery grant program for adult daycare programs, adult day healthcare, and CBAS and PACE centers. Just this week, we launched the training and stipends program under CalGROWS, and thank you to the governor for uplifting that messaging. The IHSS Career Pathways initiative is up and running and reaching so many people throughout the state. And our California 2030 initiative, this is the effort to reimagine how the AAA network can lead us for the next 50 years. CDA will be celebrating their 50th anniversary next year. So we're working closely with C4A, CFILC, CSAC, this is an acronym soup, County Welfare Directors Association, and the Commission on Aging. So thanks to everyone who serves on that steering committee. I'd love to introduce you to a new face in this group. I think our next slide, great. It is my absolute pleasure to introduce this group to Kristen Rains, the first Aging and Inclusion Specialist at the California Department of Developmental Services. Kristen, if you want to come on the screen and say hi to everybody.
Hello, everyone. Can you hear me okay?
Yes, we hear
Great.
you.
Great. Hi, everyone. Thank you, Susan. And hello, DACLOC members. So excited to be here. As Susan said, I'm Kristen Rains, the new Aging Inclusion Specialist at the Department of Developmental Services. So in my role, I'll be providing statewide leadership to advance services and supports for aging adults within the DDS system. And our goal is to better support aging adults and their emerging needs, especially those, for example, dementia, especially individuals with Down syndrome are at high risk for dementia. So that's going to be an area of focus for us. We'll also be looking at improving opportunities for individuals to age in place, supporting them in creating advanced care directives, end-of-life planning, and much more. We'll also be engaging stakeholders to learn more about the experiences of aging adults with IDD and their families, with a real focus on looking at diverse communities and currently underserved communities. So a little bit about my background. I started my career as a social worker, focusing on developing services for seniors. And then in 2005, when my son was diagnosed with autism, my focus changed to advocacy and support for individuals with IDD. I worked as a health advocate for a number of years for the ARC San Francisco, as well as the community support coordinator and a dementia care trainer with an ACL grant in collaboration with the San Francisco Department of Disability and Aging Services. After that, I continued to do dementia care trainings for vendors and families of the regional centers. And now I am here with you all and so excited to be here. So one of the great exciting roles I will be doing as the aging inclusion specialist is I'll be collaborating, and I'm so excited to be collaborating with my great colleagues, Tanya Batista, Sarah Steenhausen, and Stephanie Blake at CDA, as well as Anna Acton at the Department of Rehabilitation, Ken DeRosa at the State Council on Developmental Disabilities, and many more, 9 more wonderful organizations to create a state alliance team. DDS and CDA are co-leading this grant, which was awarded by the National Association of Councils on Developmental Disabilities. And the goal is to build bridges across the aging and disability networks to better serve aging adults with IDD and their families. So we're in the first year of this grant, and we're in the process of developing our action plan. And I'm thrilled to be a part of this grant because, much like the great work that you all do on this committee, just coming together in the same room really lays the foundation for future collaboration and better coordination of services. So this is a wonderful opportunity. And I look forward to meeting all of you. And thank you for all the great work you do for expanding community living for all Californians, including those with IDD. Thank you so much.
Thank you, Kristen. It's so great to have you in your official capacity. And I think a mark of the collaboration is the Department of Developmental Services Director, Nancy Bargman, invited me to serve on the interview committee that made this outstanding selection of Kristen. So we're just thrilled that you're here. We'll go ahead and move to the next slide. Coming up this fall, so I wanted to just touch on a few things happening this fall. One, today we welcome a new member to this committee. You'll get to meet her, Melinda Forsty, who is the Chief Operating Officer at Serving Seniors in San Diego. We had the opportunity to meet with Melinda and Paul Downey earlier this year, and to learn about the incredible work that's happening in the San Diego community around older adult homelessness and housing, and just some really pioneering work that we wanted to be a part of this committee, and we invited Melinda to join. Thank you for accepting that invitation and joining for your first meeting today, Melinda. In that vein, we will be refreshing this committee as we're doing with all of our stakeholder committees, and we'll be later this month, early July, applications and supporting materials will go out to every member of DACLAC. So we encourage you to please take note of that when you receive it, and we invite you to reapply. We've got just such a fabulous group of passionate advocates and subject matter experts that we really want to keep together. So give that your careful consideration, and also do let us know if there are voices and perspectives and parts of the state that are missing. We welcome your suggestions for new members that we can send the applications to. All of those will be recommended to the agency, and we'll have appointments late this summer in plenty of time for committee members to join for our October 11th, 2023 meeting. I will add, in October, we're really excited. We're going to bring everyone together, everyone who wishes to come together, and those who can't, to join virtually. We're going to reassemble the LTSS subcommittee and all of the people who contributed and influenced that work. You may recall this was the first piece of the master plan for aging, the first deliverable, where we really focused in on navigation, access, workforce, affordability, equity. So it'll be 4 years this October since that group first met. So you'll all be invited to rejoin, where we provide updates and hear from you again on all of those topics. So you'll be able to get a quick overview of where things are in those key bucket areas from the LTSS subcommittee. And then, of course, provide your input, feedback, and suggestions. So that will be happening. I think it's October 20. We'll put it in the chat,
October
but
25th.
Say that again, Sarah.
October 25th.
October 25th.
Reunion of the
A
LTSS
reunion.
subcommittee.
All are welcome. So with that, I am now pleased to turn the agenda over to Amanda Lawrence, who will take it from here.
Hi, good morning, everyone. I am here. I'm very excited to give you an update that the California Department of Aging has made in support of aging in disability-friendly communities. Next slide, please. So you may have already heard, but we did release an RFA earlier this year for $4.5 million to provide competitive funding to communities across California to help them develop a age and disability friendly action plan for their own community. So their own master plan or multi-sector plan for aging and disability. We call it the Local Aging and Disability Action Planning Grant Program, or LADAP. The priorities in this program, we really focused on equity practices, reaching historically underserved communities, and really looking at community engagement practices and the capacity that organizations and coalitions have on the ground. So really, we're helping communities build out what is their own master plan, which is a lot of stakeholder and public engagement. And we know that sometimes communities can be the resources can be tight and they could use a little bit of a boost. So we released this RFA and we funded communities up to $200,000 each. So far we have awarded 15 grantees from all across California for a total of around $3 million. We will open up a second round of RFAs later this summer. So please, if your community is not on the list of awardees, I'll show that in a second. If you have not received an award and you think your community is well suited to start to build out their own master plan for aging and disability, please share this information. If you go to the Master Plan for Aging's website, there's a banner up top that'll take you directly to the page, and it is also in the chat. We also are providing technical assistance to these communities. We're really excited to have partnered with UC Davis, who is going to be helping us build out a technical assistance network or platform, as well as evaluate the program so we can really share our lessons learned and learn best practices and work nationally across state borders to help promote aging and disability friendly communities get built all over this country. Next slide, please. I wanted to just share with you who the awardees are. You'll see on this list that we have organizations and health services agencies from all over the state. We have Central Coast, Northern California, Sacramento, Central Valley, Los Angeles, Bay Area. Really great applications. We're really pleased with the ones that we received. High interest in equity and providing opportunities in multiple languages and really incorporating the disability community into these aging plans. We will share more. We'll provide updates as this rolls out. We're going to have a kickoff webinar for our awardees in July to get everyone on the same page and share what the technical assistance looks like. But please do reach out and apply for these grants. All the information on how to apply is already on the website. We just haven't released the date yet, but we will be releasing the second round for applications later this summer. I'm going to go ahead and hand it over to Patty, I believe, to move us on to the next agenda item.
Thank you, Amanda. Good morning. Welcome, everyone. It's so great to virtually see you all again, although we're excited by the idea that we might actually see some people in person at future subcommittees. I want to welcome our DACLAC committee members, our agency representatives, our legislative appointees, and members of the public to this meeting. And I want to echo Director Demores' appreciation for this committee's expertise, engagement in these critical issues over a long period of time, and encourage you to continue to lend both your perspective and passion to this committee. If anybody has any questions about how they would like to participate in the future, or some suggestions for how we can make this a more meaningful forum, by all means, feel free to email me. I will put my email in the chat shortly. So today's agenda is focused on two areas that are key to both the master plan for aging goals around housing and around home and community-based services. Excuse me. Forgot to put my phone on silent. And to really advance the community homestead principles and the infrastructure that we need to support aging in place in the communities and places we choose to live. The first, we will take a deep dive into two different local rental assistance programs in keeping with the master plan for aging goal of preventing and ending older adult homelessness. And I will say more about this when I introduce that panel in a few minutes. And the second part of the meeting will focus on the work that many of you have been participating in and was the focus of yesterday's terrific forum on the HCBS needs and gap analysis. And we will have representatives from various agencies talk about that, both CDA and Department of Health and Healthcare Services will be presenting on that. And on each of these, you can see that the agenda allows plenty of time for both stakeholder discussion and public comment. We want to make sure that we provide an opportunity for the voices of you who have the expertise to really weigh in, suggest recommendations, ask questions, and have a rich conversation. And with that, I think we will also have some reports from our subcommittees, but then we will go right into our next item, which is learning from the locals, older adult shallow rental subsidies. So one of the things I'm wondering if I could have put up the first slide that has to do with the change in older adult homelessness in California. There we go. Sorry to take things out of order. So this is a striking slide in my mind, and it tells us that in the past 5 years, the period from 2017 to 2022, the number of older adults who have needed to access homeless services in the state of California has increased dramatically. For people ages 55 to 64, it has gone up 93% or almost doubled, and that it's now at about 43,000 people. And for people age 65 and older, it's even more stark. There's been 161% increase, and about 18,500 people, Californians, our neighbors, who are living on the streets or unsheltered or in shelters, but homeless and this is over the course of a year. And this data is from the California Interagency Council on Homelessness, Homeless Data Integration System. So we know that we have a master plan for aging goal of preventing and ending older adult homelessness. And I think that this chart is sobering in telling us that we're not only not reaching that goal, we're losing ground. And we need to really look at how we can turn that around. So the master plan for aging provides us with an excellent focus for those activities and initiatives. So yes, there we go. The first goal of the master plan for aging is housing for all ages and stages, excuse me. And this year's initiatives, following the first 2 years, we came together, as you know, for the Day of Action. We developed some additional initiatives based on people's priorities that were expressed. And initiative number 2 is to explore emerging local government models to inform consideration of rental subsidy programs for older adults and people with disabilities. Identify existing program parameters, including subsidy amounts, duration, eligibility criteria, and priority populations. Now, a few words about this. First, there is also a statewide bill, SB 37, that attempted to create a rental subsidy program. And although it has received a lot of excellent support, it has now been put into a 2-year bill because of our current budget constraints. There wasn't money in the budget to fund it this year. The second thing I want to say about it is, I think when we look at rental assistance, we see this as a key homeless prevention strategy, and that homeless prevention has to be a key piece of how we address older adults experiencing homelessness in greater numbers in California. So if we can look upstream and say, how do we prevent older adults from entering homelessness in the first place, and people with disabilities, we will be able to stem the inflow. And I also want to just add that it's really important that this committee and these initiatives really bring together the housing issues for older adults and people with disabilities, because they are very similar. The need for accessible and affordable housing, the need for integrated services and supports to promote aging in place, create a lot of common ground and common advocacy opportunities. So I'm going to turn it now over to 2 panelists who I'm very excited to introduce. Hannah Brady is from Stanislaus County, the Senior Advocacy Network. She is the Deputy Executive Director, and she's going to talk about the Stanislaus County Senior Subsidy Program. And Melinda Forsty, who you've heard has just joined the DACLAC committee, is the Chief Operating Officer at Serving Seniors. And finally, Susan Phillip is the Deputy Director of Healthcare Delivery Systems at Department of Healthcare Services. We're working to use fewer acronyms, so catch me if I slip up. And I want to say that we're very excited to have these 2 programs because one is in a rural area. It has its own unique housing issues. It has its own unique ways in which housing is made available, ways in which you can work with local partners. And then in contrast, we have Melinda talking about the San Diego program, or actually 2 programs that you'll hear about shortly. And so we felt having a rural and an urban, having one in the center of the state and one in the south, and different ways in which the housing constraints operate and how these programs have responded locally will give us the information we need to advance that second initiative that you just saw. Because we want to, in this year, move from exploring to advancing a proposal. So with that, I'm going to turn it over to Hannah.
Thank you, Patty, and good morning, everyone. I'm really happy to be here and talk to you guys about our very local rental subsidy pilot program. We started as a pilot program in 2021, and I would say we're a little more than stable than a pilot program right now, but still facing certain constraints that I'll get into as we move forward. I put all my contact information up there for anybody who wants to reach out to me later. I'm happy to give any extra information that we don't get into. Next slide, please. So I wanted to start the conversation with funding. We, as I mentioned, started with pilot funding from our local area agency on aging. They had started this conversation well before I was in the picture. I've been working here for about 2 years, but weren't exactly sure how to start, where to make it start. And so it started with CARES funding with 40,000 from them to launch the pilot. And they really gave a broad invitation to build it kind of in conversation with them. And we got immediate traction because we are actually embedded in an organization that is also a legal aid for seniors, and one of our main programs is a homelessness prevention program. So we already had a stream of older adults who are facing housing instability in one way or another. So we use that to kind of kickstart the program. From their area agency on aging went ahead and continued to partner with us through ARPA, and we will have that funding through 2024. And then I was also able to secure some private funding for $100,000 for 1 year, potentially more. We'll see how that goes next application round. And that will go through the end of this year. But overall, none of these are permanent. None of them are going to be ongoing moving forward in our county. So that's one of the challenges that we're facing in making this permanent. And it's a conversation I have every week with the people that we're serving, is that, you know, we will serve you for as long as we can, but right now you're part of an initial cohort. Go ahead and go to the next slide, please. So in terms of design, eligibility was a conversation that we had a couple back and forth with AAA. And these are the basic tenets, even though when you get into the onboarding, they can be a little bit more specific. They have to be at least 60 years old. They have to be low income. Our metric is the federal poverty limit. We will go up to 200% of the federal poverty limit. But we do have tiered priorities within those. Tier 1 is 100%, tier 2 is 150. But as it stands in our county right now, we haven't had to turn anyone away who was at least within that 200% federal poverty limit. They have to be severely rent burdened. That means their current rent or current portion of the rent is at least 50% of their total income. They have to have a lease, a contract, a document showing their housing that does have their name on it. We're back on the front one. And then the last two bullets are two aspects of the eligibility that we built in that I'm really proud of, and that I think have really turned this program from just, you know, sending checks to an interactive process with our clients. The first one is a requirement to be engaged in proactive long-term housing counseling. So we do that in-house. Somebody comes to us, they're interested in the subsidy. And the first thing they do is that they get assigned a housing caseworker in our program, not just to get the paperwork together, but to really start that conversation of what is sustainable for you long-term, and what do you want to have be your housing 1 year from now, 2 years from now, 5 years from now. In our county, there's two main options. Obviously, for the people who want to stay in place, there's things that are possible and things that aren't possible. But in Stanislaus County, our housing authority has the in-place housing choice voucher waitlist, which is open and which processes applications fairly quickly, meaning that if somebody is already in place and their house is within fair market value, they can get a housing choice voucher sometimes in less than 6 months and usually in less than a year. So our subsidy is made to be 2 years maximum, or until the funding runs out, of course. If they aren't interested in staying where they are, or they can't stay where they are, then we start the conversation about where could they apply to get on a wait list for housing that is already subsidized, you know, Project 202 housing or LIHTC housing, something along those lines. In our county, again, the average wait list time for any of those properties is 2 to 3 years, which is different than the bigger counties and the bigger cities in our state. But 2 to 3 years is still, if we can support them for those 2 to 3 years to stay in place, pay their rent, maintain a positive relationship with their landlord, and then they can transition into subsidized housing, then that stabilizes them in a more long-term way. But it is client-led, client-driven. We want to find the solution that works for them, and we will work with them in order to achieve those goals. And along with that those housing counselors are always thinking from a housing focused mindset. So they're also connecting them to other resources that might make their housing costs more sustainable. A lot of older adults, when they're coming to us, it's really their first time reaching out to get support. And so maybe they're not connected to CalFresh. Maybe they've never heard of SSI, something like that. So we're helping them with income supports. We're helping them with all these other social supports so that the percentage of their income changes based on where they can get support from the community around it. So we're using it as a carrot and supporting them to get connected to other things. The last piece is landlord participation. We do have to, you know, for tax reasons, get W-9s and all these other documentations from the landlords. And it's led to some really interesting conversations. Just like everywhere else in California, rent has been going up in Stanislaus County, and the average 1 bedroom here is about $1,500 right now. And the typical, you know, income for someone who's around 100% of the federal poverty is closer to $1,100. So we're talking with landlords about what is a legal rent increase. We're referring our clients to legal services if they need them. And most importantly, we're bringing up the conversation about source of income discrimination, which is relatively newer in California, and educating landlords and telling them, you know, you can't tell someone that you won't accept money from a local pilot, a subsidy like ours, or from the housing authority. And that's been especially effective with mobile home parks who are kind of new to the game in that field. And just across the board, we've really only had one landlord who's kind of putting up a fight, and the rest of them, you know, they need that education piece as well, but they want to be on board, and they majority want to support their tenants. Next slide, please. In terms of the service model, it's really simple. We do direct to landlord rental payments. We do not send them to the tenants because we do not want to have them have to count that as income. It is $200 per month per eligible tenant. It started as $100, and then we decided to shift based on budget and onboarding trends. Like I said earlier, it is short term. We explain that very first thing so that we can know that we're in there to do some work with these clients up to 24 months. And we do verify eligibility annually so that they'll stay on that whole year, even if, you know, their income changes, anything like that. So far to date, we have made more than $180,000 worth of subsidy payments direct to tenants, and that affected 107 individual tenants since we started making payments in November 2021. Next slide, please. So the successes, just to kind of give a really quick brief overview. To date, we have had 53 program exits. 55% of those did secure an HCV or other subsidy. There's rural subsidies and mysterious subsidies that not everyone is aware of all the time that they can access. 13% of those moved into permanent housing, and then some others passed away, and then a few others exited for other reasons. But that represents nearly 70% of our program exits who either moved into permanent subsidized housing or secured a long-term subsidy. And on average, in order for these clients to exit, it took 9 months, which represents an investment of about $1,800 per tenant. And I am part of our local COC, and we talk a lot about, developing new housing, prevention, intervention, all those things. And when we're talking about developing brand new housing, even in our county, that looks like about $500,000 per unit for a brand new 1-bedroom unit. So this is a completely different take on securing housing, stable, permanent, supportive housing for clients who want to be in their own unit still and are able to, for a very low per capita investment. And I am going to leave it at that, although I know Melinda and I are going to go back and forth on some lessons learned at the end and pass it off to you, Melinda.
Great, thanks, Hannah. Well, good morning, everyone. Really happy to be here and now part of the team. Looking forward to working with all of you. As noted, my name is Melinda Forsty. I'm the COO of Serving Seniors, and we're a nonprofit based in San Diego. And if you can please move to the next slide. So I thought it would be helpful to provide a little bit of context on how we got where we're at now within San Diego. So back in 2020, Serving Seniors was able to obtain a grant and partnered with a local research firm to conduct a comprehensive needs assessments on older adults. This encompassed folks that were currently experiencing homelessness, but also a cohort of older adults that were housing insecure. And I really think it's critical to highlight some of the key findings. So one of the most important findings that our study showed was that the majority of older adults that became homeless was primarily due to an economic issue. So this could have been the loss of a job or a spouse. It could have been a medical illness, or often it was simply increased rent on a fixed income. If you look at our second bullet, one of our biggest findings also was that more than half of the older adults that we surveyed shared they needed only $300 or less of monthly income in order to remain housed. I think one caveat that's important to note was this data was collected between 2020 and 2021. So in light of inflation, we do understand that, particularly in certain parts of the state and certain parts of different counties, that dollar amount will need to be adjusted. And then another major finding was that more than half of those surveyed had either borrowed money, had gone without food or medication, had sold personal items, or had allowed others to live with them, even if they felt unsafe, in order to make their rent. So we heard really loud and clear from the over 400 older adults that we surveyed. This is really an economic issue. And as Patty and Hannah both noted, with a much smaller investment from a shallow rental subsidy program, we would have been able to keep hundreds and potentially even thousands of older adults in our community housed with a much smaller investment versus waiting for folks to lose their housing. Please move on to the next slide. So really one of our main focus areas was to raise awareness throughout San Diego and frankly throughout the state and country, really about the state of older adults. So our team met with a lot of elected officials. Again, this was at the local, state, and national level, met with a lot of philanthropists, and really raised media awareness about what was going on with older adults throughout the community. We are really happy to share that within 6 months of releasing this needs assessment, we were able to advocate for the County of San Diego to launch a pilot shallow rental subsidy program. In addition to that, the City of San Diego also expanded their shallow subsidy programs for families and for older adults. On the Serving Senior side, we were able to accept funding for our own shallow rental subsidy programs that are administered directly by our organization. And I'm going to touch a little bit on the eligibility and the differences between these shallow subsidy programs. But I did really want to highlight that we are talking about real people here. So one of our seniors that we helped, his name's Mario. He's 68. He was chronically homeless for over 12 years. He came through our programs and became housed. But while he was housed, he did come to our team and share he had been diagnosed with cancer and was going to have increased medical costs. So our team was able to get him connected to the shallow rental subsidy program, which enabled him to meet those medical costs. But in addition to that, it also really highlights the importance and power of case management. Because now that he was connected with our case managers, we were able to connect him with in-home support services and connect him with an array of other resources. Can you please move on to the next slide? So I'm not going to go through bullet by bullet, but what I do have here is a comparison again of our program serving seniors versus the county's program. As I noted, ours are funded through 2 different private foundations, while the county's program is funded through ARPA and what's known as the American Rescue Plan Act. They both have slightly different time frames. So we have 2 years for our program, and ours is using a $300 a month flat rental subsidy, while the county's program is a little bit shorter, about 18 months with a $500 per month flat rental subsidy. In terms of eligibility, they're both pretty similar, and I think you can see that there are some similarities with what Hannah showed as well. I think the most important thing to point out is the prioritization. For example, the county program has about 200 slots available for the program, which launched last month. But we do know that over 6,000 individuals have applied. And so really, the county really is prioritizing those that have the greatest amount of rent burden. So 50% or more of their income going towards their rents. Those with the lowest AMI, and that stands for area median income. And similar to Hannah's, there is a case management proponent along with landlord participation. For serving seniors programs, we are focused primarily on urban areas. And for the San Diego County's program, this is county-wide, but it is prioritizing zip codes that are at higher risk. Can move on to the next slide, please. So for both serving seniors subsidy program and the city and county's program, there is a data and evaluation component to this, because we know that it is critical to be able to capture the outcomes, but also capture the best practices. What's working, what's not working. So what I've highlighted here are just some of the key data points that we're capturing. So what is the current housing stability status 6 months out, 12 months out, and 2 years out? And also, what other outcomes have we been able to achieve? Have we been able to reunify some of these older adults with their families? Have some folks been open to shared housing? Particularly in San Diego, we know that there's about a 3% vacancy rate. So really wanting to look at a lot of different creative solutions. We think looking at quality of life is critical. And some of our preliminary data has already shown, a significant increase in the quality of life and a decrease in both depression and anxiety for the older adults that we've served. And then really looking at additional case management outcomes. have we been able to connect older adults with other benefits, other providers? And in some cases, some of the seniors have shared that they are interested in reentering the workforce. So while that's going to be a smaller cohort, we do know that that is also a critical component for at least some of the clients that we're serving. And then just really taking a step back and big picture, as Patty noted, we know that SB 37 has been introduced. And really our goal is to coalesce the data that Serving Seniors is collecting, that our local municipalities is collecting, and then really partnering with other programs like Hannah's and other municipalities throughout the state to further advocate for program expansion, enhanced legislation, and increased funding. So with that, I'm gonna turn it back over to Patty, because I know we are gonna have some time for some additional dialogue and questions.
Thank you, Melinda and Hannah, for those both great presentations and for the work you're doing in your communities. And I'm going to turn it over to Sarah now to lead our discussion, but I'm hoping that you will both talk with each other about your programs and some of the challenges, and also to the extent, and you mentioned this, Melinda, that you are doing an assessment and evaluation. That seems really key of how we can make sure that these local projects have the capacity to do that, so we can glean important lessons for how to structure one on a larger level consistent with the master plan for aging. So Sarah, take it away.
Well, first, thank you so much to Hannah and Melinda for just wonderful and very informative presentations. I'm really, really pleased that we have been joined by Tani Maceda, who is a housing policy specialist at the Business Consumer Services and Housing Agency. We're really pleased to have DACLAC include representation from our cross-agency partners, as this is critical in advancing the priorities of the MPA. And Tani has been here to listen and learn about these local level models, and she will be sure to, if she has any questions or requests for additional information, we told her to feel free to engage and follow up with this committee or with us afterwards. But before we get into Q&A, I'm really pleased that we are also joined by Susan Phillip, who is Deputy Director at the Department of Healthcare Services and really leading on so much of the implementation of CalAIM. And you might be wondering, why are we talking about CalAIM when we're talking about housing? But knowing that CalAIM has such a focus on this broader whole person approach to care and the community supports focused on housing, as well as a rental subsidy, rental assistance that has been proposed to CMS as part of CalAIM. And so Susan is here right now to give a very brief update on where that effort is, since it also relates to housing and rental affordability. So thank you, Susan.
Great. Thanks so much, Sarah. Really appreciate it, and really appreciate being here with you all today. So I just wanted to give, as Sarah mentioned, a quick update on our transitional rent proposal. So, as we're discussing here, obviously housing services and supports are really, critical to help improve the health outcomes for Californians, including our older adults and our individuals living with disabilities. And so Medi-Cal has housing related community support services already included as part of the Medi-Cal managed care program. So that includes housing related community supports, which includes housing transition navigation services, housing deposits, tenancy sustaining services, as well as recuperative care and short-term post-hospitalization housing for folks transitioning from inpatient settings. So those are already currently part of the Medi-Cal managed care program under the umbrella of community support services. So in terms of transitional rent, there are a couple of other states, Oregon and Arizona, that recently received approval to cover 6 months of rent under their Medicaid programs. And they received approvals from CMS under their 1115 waiver authority. This is 6 months of rent for individuals that are transitioning out of institutional care or congregate settings, which include nursing facilities, large group homes, congregate residential settings, correctional facilities also, as well as acute care hospitals. So this 6 months of rent to cover that transitional period. Also for individuals that are transitioning out of emergency shelters, and for children and child welfare system, including children in foster care. So that's Oregon and Arizona. So we are currently working on developing a proposal to submit to CMS through our section 1115 demonstration authority. We're going to be doing this through the CalAIM waiver, as well as our Behavioral Health Connect waiver, and under section 1115. So this is, we're going to be seeking authority to cover 6 months of rent for eligible Medi-Cal members who are homeless or at risk for homelessness, and again, transitioning from those critical care settings, including nursing facilities, acute care settings, and certain congregate residential settings. So there will be more information about really what that looks like. We're really in the midst of doing the policy design, developing the parameters, really thinking through eligibility criteria, really what do these services look like, and how will they be available through our managed care program, as well as through our behavioral health system. The draft of the waiver will be posted for public comment in July of 2023. So that's coming very soon. So I really would encourage everyone to take a look at that. Please provide us comments during the 30-day comment period. Then once we receive comments, we'll be working on creating updates, and then we're targeting submitting the waivers by this fall, targeting October. And then there'll be negotiations with CMS and discussions with them. Usually I think it would probably take about 12 months potentially for those approvals. And then we're looking at go live no sooner than January 2025. And we'll be taking a phased approach. But so that's the overall framework of this community supports and the transitional rent services that we're looking to have available through our Medi-Cal program.
Wonderful. Thank you so much for that update, Susan. I really appreciate it. And I think now what we can do is open it up to Q&A. We had such wonderful breadth of information that we heard from our partners at the local level, Hannah Brady and Melinda Forsty. We would love to hear from all of you. So if you on the committee have a question, please raise your hand, or even if you want to make a comment, and we will elevate that. It looks like we have Jared up first. Thank you, Jared.
Good morning. Great presentation. I had 3 questions that I was curious if Hannah and Melinda, you'd be able to answer. So first is there, and I put this in the chat, I think, the maximum amount of the subsidy, is there an ability if the participant wants to go underneath that amount? Is there that flexibility? So that's the first question. Second question is, what kind of data are you utilizing to determine whether or not this is the most cost-effective housing intervention strategy? And then lastly, how sustainable is the funding for your 2 programs?
I'm happy to start, Melinda, because I think
Sure.
I'll be short. So the first question is, we change the amount? We do not give the option to change the amount. Once you qualify, everybody gets that fixed amount until they're no longer eligible. The second question was about if this is the most cost-effective intervention. That is a much bigger question that I don't think I have all the answers on yet. I provided the information on like the average per capita that we're seeing, and just for a little bit of context, gave like the approximate cost of how much it costs to build a new unit. And then just from personal experience, I know how much people tend to get on when they're officially enrolled in the Housing Choice Voucher Program. And it is more than that. So, so we're working kind of at the lowest possible level of intervention to still maintain someone in their household and move them towards greater sustainability. So that's kind of the perspective that I have for that. The funding, as I mentioned, for our programs, not sustainable at all. We have probably until mid 2024 before we're going to have to either discontinue or have other sources already in place.
Thanks, Hannah. So for our programs, they are fixed amounts. Frankly, I think if anything, most of the older adults would prefer additional subsidy. But one thing I do want to point out, Jared, is there's a third program, which I didn't touch too much on, and this is through the San Diego Housing Commission, and that's the housing authority for the city of San Diego. So they've been having housing subsidy programs for a little bit longer. So one change they have made is that they now have a tiered system. And again, that's based on economic need. So for their subsidies, it can go from either $250, $500, or $750, again, depending on the financial need. So I think it's going to be interesting, particularly as we continue to collect the data to see, which one works best. In terms of funding sustainability for the programs that Serving Seniors runs, that is all through private foundations. For the county funding, that is through the American Rescue Plan Act. So that does end in 2024. So I think that's why we are really focused on continuing all of the great efforts that this team has done to hopefully identify a permanent funding solution through the state, or at least, have something pushed through similar to SB 37. And then to the third question about cost effectiveness, that is a great question. I've heard from different studies that the annual cost of an individual experiencing homelessness can range from $30,000 a year to $50,000 a year. I know that there's a lot of different factors with that. What I can share is what we've identified, depending on the subsidy, it can be anywhere from about $8,000 to $12,000 per person with the subsidy and with the case management, so per year. So, that certainly seems a lot more cost effective than the $30,000 to $50,000. But I think that also will be a critical data piece to continue to look at moving forward.
Thank you both for your responses to that. And I see we have a number of questions, which is great because we have about a little over 20 minutes for this Q&A. Nina, you're up, and then Claire from DSS.
Hi, good morning, everybody. Okay, I have to remember my questions. I put them in chat. Number one, and I know Connie also put this in Q&A, these sound like wonderful programs, and certainly building the foundation for what we want to see happen statewide. Are these, the slide that I saw mentioned light, I'm sorry, I think it was light care coordination. How would that work with somebody who has needs for assistance with activities of daily living? Are they supported in these rental subsidies program? That's my first question.
And I'm happy to jump in. So on our side, we do have a team of social workers and health educators. But if there was a need for IHSS, that would be one of the first priorities they would identify and try and get them connected. Of course, we do know there's a lot of challenges. There's not enough IHSS caregivers right now, but we would certainly help get them connected to the County of San Diego, which runs that program.
Okay. And then my next question that I had in chat, I'm sorry, I can't remember what I asked, had to do with CalAIM and people who are share of cost. Can you clarify if somebody is Medi-Cal share of costs, so this is really for DHCS, can they access CalAIM? I had heard somebody at a recent meeting saying they couldn't, so I'd appreciate the clarification.
So the transitional rent services that are under community supports, you'd have to be a Medi-Cal managed care member. So it's provided through the Medi-Cal managed care program. So if you're fee for service, you would not qualify for that service. So it is provided through a managed care program.
I do want to note that I know, Susan, you need to be departing, so we thank you so much for being here and providing the update. And if there are other questions that come up, we will be sure to follow up by email. So thank you for that.
Yes, thank you so much. And please do sign up for our stakeholder update so you are notified when we put the waivers out, because we want you to be notified and get any public comments.
Wonderful, thank you. Okay, Nina, did you get your questions answered? Or do you have more questions before we move on?
If I have another question, I'll put it in chat.
Perfect, thank you so much. And I'm so pleased that we've been joined by Claire Ramsey, Chief Deputy Director at the Department of Social Services. Claire, welcome.
Thanks, Sarah, and thank you all for that those great presentations. Really appreciate that work you're all doing to support older adults. One of the things I was thinking as you were talking about some of the services you're offering is the Department of Social Services runs a few different housing and homelessness programs that have fairly flexible funding, although they don't typically pay for shallow rent subsidies ongoing in the way that you're talking about, but they do involve case management. They can involve disability benefits advocacy. Sometimes they can pay for like other pieces of the puzzle, you know, like home modifications or deep cleaning, things like that. And I was just wondering if, since you are both working sort of in the CBO space, are you connecting with your county, or is your county connecting with you at all around making those programs available for your participants? And that would be things like Home Safe or the Housing Disability Advocacy Program, HDAP. Just curious if those have started to sort of be helpful for the seniors you're serving.
Yeah, I'd love to jump in here. So I actually, we are the contracting community partner for Home Safe with our county. So we are particularly well suited to put those puzzle pieces together, and absolutely. It has been major, specifically for our older adults who are already experiencing homelessness. That huge jump from getting them from being unhoused into housing. We have used Home Safe as the initial plug, written cover letters to landlords to then tell them that following that move-in, they will have a rental subsidy and that they will continue case management after that. And we do the long-term case management through Home Safe for those 6 and 12-month check-ins. We also partner very closely with the local organization who runs HDAP, and all of our case managers have been trained on that. So there's a lot of magic that can happen when those are all put together, and I think they're really natural partners for each other.
Thank you so much for that. Claire, anything else before, any other comments or questions before we?
No, that's okay. I'll let everyone else have their turn. Thank you.
Wonderful. So we have Marty Emoto up next, and then Sherry Burns and Jeannie Parker Martin. Marty, welcome.
Hey, Marty Emoto, family member. My older sister had developmental disabilities, and I'm a parent of a 30-year-old with Down syndrome and on the autism spectrum, and we live together. First of all, I just want to thank Hannah, you, and Melinda for a fantastic, hopeful presentation. And I think it underscores that, you know, things can work if we have the right resources and people to help with that. And there's never enough money, right? So but I really appreciate, I think all of us do, the presentation that you provided. One question, and it's more of a comment, but I think it's an actionable step that either the subcommittee or the full committee as a whole needs to look at. And it goes back to the work we did on the master plan for aging of the no wrong door. As a parent and also as a family member, one of the worst things that can happen is that we have to go through multiple doors. And even if we get there, we're told to go to the next door, and we go to the next door and that person can't help us. And then we're not told about the door that actually can help us with additional help to get whatever it is that we need. And I think as you're doing this light case management, and again, it's not a criticism on you because you have limited resources. I guess the issue or actionable step is how do we get that information to the right people at the right time? Because whole person-centered advocacy and planning is not getting the information whenever we can get it there. It's getting it when they need it and getting the help that they need. Don't expect your agencies to know all that because you're limited in your reach. The fact that you're trying is admirable, and I respect that. But if a person needs supportive services, Melinda, you mentioned IHSS, but what if they were eligible potentially for regional center services or some other in-home services through their managed care plan? And if you're not told that, and again, not a criticism towards you, we got to think of some actionable steps that help people not go through so many doors to get the help. And also the valuable information you're collecting is somehow not lost. It is now moved to the right state agencies or local agencies so that we have a better fix on the housing need and also a better fix on trying to get the right help to that person. Again, my son, when he was having a health crisis, he was in hospital for 30 days, nursing home. Later on, home health agency was with us up until January. They had a social worker, case management, wonderful. Like they helped us. We gave them information. I ended up giving the same information though, 5 different times to 5 different agencies. And I do want to commend though that we did get help, but if you're repeating the same thing over and over, it's just frustrating, and it's nothing against the work that you do. It's really about how do we as a committee and a subcommittee work to get that information so that people are not going through so many doors. It was a big priority with the master plan. And then Melinda and Hannah will work together on the subcommittee to get an actionable step towards this and also get you some more money, right? That's what you need. And lastly, I just want to thank Patty for putting together this panel. And Patty, thank you for explaining the abbreviations. I really want to encourage the committee to really, if you're going to use acronyms and abbreviations, just understand something. When you translate an abbreviation into Spanish, Japanese, or Mandarin or any other language, it still comes out as an abbreviation that no one knows what you're talking about. So DACLAC, POS, all these different names, please, if we're talking about accessibility and outreach and equity, we're the good guys. This is something easy. We can explain what those abbreviations mean. And I'm going to get really upset with all of us. I've done this for 25 years. And when I write reports out, I have to look up what those abbreviations mean. And sometimes even I forget. If I can do that, we can spend the time and effort on additional letters in our agendas to make it easier to translate to the people that we're trying to reach. And I don't give a rat's ass how people feel. And by the way, rat's ass is not an abbreviation, but I will be fierce on this issue because we cannot just talk about outreach to the community if we are using words, abbreviations that have no meaning to anyone. So let's stop it, okay? We're trying to reach people. And lastly, love you, Melinda and Hannah, and also Susan for doing this tremendously great work. So I want to end on that note. So thank you. On behalf of my family, thank you.
Thank you, Marty. It is very, very important that we all, especially myself, remember that. So I really appreciate the strong reminder. Sherry and Jeannie, if you don't mind, we did have a couple of questions from Tani Macedo from the Business Consumer Services and Housing Agency. So I was wondering if I could call on Tani right now to elevate her questions. Thank you again for being here, Tani, and welcome. And then Sherry and Jeannie, you're up next.
Excellent. Thank you so much, Sarah. I really appreciate the collaboration, coordination, and inclusion in this conversation. Thank you so much for the presentations, really being in listen and mode to hear what some of the local best practices are. I'm really curious. I love that there were examples from both rural and more urban areas. as folks who, are really familiar with some of the housing issues, we know that this can look different in different parts of the state, right? Depending on what the housing stock is. And so I'm really curious if there are any lessons learned or thoughts around how these programs are working in areas with low vacancy rates, right? Where there's limited housing stock and in terms of, connecting folks to housing. So if there's anything that the presenters could share on what those experiences were, and if there's kind of gaps or things we can learn from these pilots. Thank you.
I'm happy to jump in. I think I had shared San Diego's vacancy rate is around 3%. I think landlord engagement is critical. It's something that Serving Seniors is getting more involved with. But we do also know that the San Diego Housing Commission has a whole landlord engagement program, which is critical. I think also providing additional incentives, frankly, to the landlord. So in addition to the shallow subsidies, if people need assistance with their first month's rent, with their security deposit, those have been effective approaches. And that's why I also mentioned the shared housing, because frankly, there's just so few housing in San Diego that we really need an above the, check all the above approach. So whether that's finding units for folks to move into together, if it is family reunification. And then I do think it's continuing to raise awareness, not just with the landlords, but with the community as a whole. So it's quite the challenge. But again, I think, we're taking strides and hopeful that, we'll continue to get even better landlord engagement.
And I'll tag on to that. The last I heard in our county, we have a 2% vacancy rate. So it's the same rural and urban. The housing crisis does not look that different in terms of housing availability. Our agency, I have so many pots going. We do also run a home share program that does prioritize seniors. So we are pursuing that avenue of increasing housing at the same time. And just like Home Safe, we will intermix that with our subsidy to just increase the housing units that are available, bedrooms. But really we're following where the client leads us. If they want to pursue shared housing, then we'll find that road. If they want to move out of county, we'll make a call for them, anything like that. One thing that I was going to add about the landlord engagement, it is a really crucial piece, but one thing that we've had in our county is that these incentives and other things kind of almost get combative between agencies. Like we're always trying to level up, like we'll do a double deposit, we'll do the first 2 months rent. So maintaining those conversations with community partners so that we're not putting our clients in competition with each other, and we're finding the best person for the best program and making sure that kind of we're presenting a united front to people and that everybody deserves housing, and that we're going to put in motion the resources we can to get them there.
Thank you so much, Hannah. I believe that, and Sherry, you're up next, but Patty, you had a response to Tani's questions.
Yeah, I wanted to thank you, Tani, for your question. I think it's really important to look at some of the practical barriers, and I feel like, Hannah and Melinda really are experts on some of those best practices. And I love that about making sure that we're not competing against each other in the scramble for housing. So I have sort of two thoughts on this. One is Hannah alluded to before the importance of educating landlords about source of income discrimination, and that is such an important piece. If you have somebody already in housing who's getting that extra $300 or $200, it's easier to say, here's the law. And by the way, we have a civil rights division that enforces it. And we will work with you to make sure that it's not overly cumbersome, but very important to make sure that landlords are being educated about that. trickier to do when you're an applicant, because if there are 27 applicants for a given unit, very hard to really determine what the reason was why your client got rejected, and that it might not have been the subsidy being paid, being used to pay the rent. And then the second thing I just wanted to raise is, I think, you know, we have all these great local pilots happening, but it seems like in order to advance the Master Plan for Aging initiative, what's really needed is good evaluation. And that I know Melinda has said that Serving Seniors has some money to do that evaluation and can actually, it sounds like, compare the 3 different programs that are operating in San Diego, each with their own flavor. That'll be terrific, because it'll give you some real-time data, and that we'd love to see, here's my plug, we'd love to see the Stanislaus County program get some money for evaluation, so that we can have a meaningful conversation about what are the best practices, what works and what doesn't.
Thank you so much, Patty. Appreciate it. And so Sherry and Jeannie, you are up next, Sherry.
Yeah, thank you. Sherry Burns, Executive Director at Silicon Valley Independent Living Center serving Santa Clara County, and also representing the California Foundation for Independent Living Centers on the panel. Such a wonderful, rich, and important conversation that we're having, and thank you both for the excellent presentation and also the research that Melinda, that you did before. So we have a lot of additional background to support SB 37 and a statewide rental subsidy program. I also wanted to thank Marty for his personal and passionate comments that not only on the acronyms and abbreviations, but talking about the importance of No Wrong Door and the expansion throughout the whole state of aging and disability resource connections. And part of that is having universal intake processes. And so people don't have to repeat the same thing over and over and over again. So we need to keep that in mind as also one of the important goals and objectives for us to continue to push forward and serving our older adults and disability populations. Thank you, Tawny, for the question about the housing resources and also about the question with regards to the partnerships, because obviously that's vital. No program service is going to be an end all and be all for everything. So having those partnerships, having those coordinated services in your area is so important, and bringing everybody together and meeting those needs and putting together those care coordination plans and interventions that are needed. I wanted to focus on one of the things that mainly you, Hannah, had mentioned with regards to long-term housing stability. And it looked like a number of folks were able to get into subsidized housing. And I'm wondering, you also said, I think that you serve on the COC in your area or in the advisory committee. I'm wondering how essential was advocacy efforts to address the coordinated care system in your area in order to have some Section 8 vouchers or complex Section 8 covered complexes available for some of the folks that needed to find long-term housing that was going to be more affordable for them long-term. I don't know about other counties, but here, again, we have such a dearth of affordable housing and certainly less permanent supportive housing available that it's impossible for people who are deemed already housed and not unhoused and not at risk for lots of other kinds of difficulties and barriers in their life to actually obtain any kind of permanent supportive housing. So this population would be really, really low on a standard list of being able to access subsidized housing opportunities. So I'm wondering how you address that in your area. And Melinda, if you're also working, that's something that you've been working on, and any changes were made in your coordinated care entry system, that would be helpful for you to share. Thank you.
Thanks for the question, Sherry. So I will say, you know, our COC, we are definitely in a growth period right now, and there's nothing that I've done at that level that has like yet opened a door to specific access for this population. I'm still really laying out the playing field for them, that older adults need a specific focus. People with disabilities need a specific focus. So that's at the very beginning, because even right now, you know, a lot of the people who are providing expedited access to mainstream housing choice vouchers, for example, that has an upper age limit of 60. So you cannot apply for that voucher if you're older 60. So that takes you out of that running already. And then the in-place housing choice voucher, that doesn't start until you're 62. So there's all these strange exclusions for this population from accessing these. So in our county, we are using the routes really that are already in place. We haven't innovated anything yet, except for having a very clear picture of what is and isn't available so that people aren't running in circles anymore. So we know the eligibility criteria for the in-place housing choice voucher. But it is open to the public, right? Anybody could do this online, but people don't know that our county has a preference. Our county housing authority has not opened up to the public. You know, they're still all working remotely, so they're very inaccessible, specifically for people who aren't, you know, able to use technology in the most accessible way. So we're the intermediary on that front. And then in terms of accessing units in subsidized housing, we started with a list that the county gave us, and then we manage an updated database of whose wait list is open, how long it is, how do you get on it. And we are talking with landlords basically every month to update those lists, but those are done very manually without a ton of support from the COC. I honestly, I don't think the COC even knows really, you know, which supportive or subsidized housing units there are in our county. So there's still a lot of education to be done for our county, for the COC, which is the continuum of care. And it is both a funding agency and an advisory agency for homeless services that is present in every community across the US.
Thank you very much, Hannah. I note that we're running a little short on time. I just want to see if Melinda, you wanted to add anything to that? Or otherwise we'll move forward to the last two questions.
You know, I think I would just add, just one of the key results of this needs assessment was our president and CEO, Paul Downey, actually did join the local continuum of care. And based on these findings, they did form an ad hoc committee on older adult homelessness. And from that committee, they have created a whole list of recommendations that are really focused on the needs of older adults. So happy to share more information on that, but I think that's an important example of how advocacy was able to make some changes with the continuum of care and their initiatives moving forward.
Great, thank you.
Thank you so much, Melinda. Okay, we have two final questions, and we're going to move to public comment. Jeannie and then Peter Mendoza. Welcome, Jeannie.
Yeah, thank you, Sarah. I'm Jeannie Parker Martin with Leading Age California, and I appreciate the presentations by Melinda, Hannah, and Susan. Your county's leadership and your leadership in moving us forward to these shallow subsidies is so critical. And they're also in alignment with the work of Margot Kuchel, who I know many of you have heard speak, and who is an advocate along with us to assure that more affordable housing or more housing is accessible to older adults and those with disabilities. So thank you. My question is directly related to some comments that Susan brought up, but I think both of you would be familiar with PACE. And I'm curious, in the context of your work, how often you're referring some of your individuals to PACE providers and or partnering with PACE to expand the work in your communities. Because I think that this program, along with these shallow subsidies, and hopefully SB 37 will pass at some point and be made available. And at the same time, how can we move forward with expanding to other counties with our existing resources? So the question really is around PACE and relationships with PACE.
Yeah, we've been working with PACE for years now. So they're partners both at the housing properties that we own and operate, which are tax credit buildings, But we also just recently opened a non-congregate shelter, and we do have some clients there that utilize PACE. So they've been a great partner and referring source for us.
And the funding that Susan mentioned for housing, is that available or accessible to your residents, to your clients, I guess, in addition to the subsidies or in place of the subsidies that you're providing? Do you know?
So I'm not sure if that is specifically available, but there are additional programs available through our housing commission that we've been working with, where they would, again, assist with deposits and also looking at arrears and then other needs of the older adults.
Yeah, we partner with the PACE programs around our community. We actually get a lot of referrals from them, and then educate people on what that could look like and encourage them to reach out. And then in terms of CalAIM, we're in the process of becoming a community support through CalAIM. So any clients that were members of that managed care plan would be eligible for those services, but that's still, I will say, one of the biggest hurdles for that. We are a very small organization. We have 22 staff members. The biggest hurdle is that every program that you sign up and bring in has a different data collection, reporting, evaluation, tool, requirement, procedure. So it's very heavy on the agency side, even to be able to move those tools for your clients. We're doing that. We're starting that work. But CalAIM in particular, I've done the training, very, very heavy.
Thank you.
Thank you both very much. And finally, one last question, Peter Mendoza. Welcome, Peter.
Thank you. Great to be here with everyone, and great to be, this is a great presentation. And let me just state first, I'm here in the capacity of a consumer representative, meaning my opinions are myself. I should just state for transparency that my day job, I do work for the State Council on Developmental Disabilities at the regional office. But however, again, I'm here as myself. It's great to be with you. This is a great presentation. Just a couple of quick questions. One of the barriers of people with disabilities, and this is a cross disability issue that affects many folks, is the inability to navigate the housing application process and to really understand the various programs that are available. For example, if there's a waiting list for people over 62 or under 62, for example, the nuances or the specifics sometimes are difficult to understand. I'm wondering what your two agencies are doing to help people navigate that piece. And then I have sort of a second follow-up question. The other issue that many people with disabilities and older adults experience is the inability to keep housing, because as people age or based on disability package, they have difficulty following up with the paperwork, or they may not understand how to ask for reasonable accommodation. How are you folks addressing those issues when they come up?
I'm happy to start. So our housing counseling program was the very first program that we started here, even before the rental subsidy. And it's a very simple concept. We have the list of subsidized and affordable housing. We have an appointment, we sit down, we talk about what they're interested in, what they're eligible for. And we start with 4. We start with no more than 4 properties, because we do not want to get people lost in the weeds of paperwork. And then we have a conversation about their ability to, their confidence level in filling out paperwork on their own. If they do not feel confident or are able to fill out paperwork on their own, then there's a follow-up appointment where they sit down with their caseworker. They fill out at least one application from top to bottom. So mostly the questions are the same, right, on every application. They get the signatures, which is the main thing that you need written from the person. And then the housing caseworker will go back through, fill in all the applications, email them in, send them in, and follow up with the properties within 2 weeks to guarantee that they did actually get on that subsidy list. So we're taking on as much or as little of that job as is needed on a case by case basis. In terms of maintaining housing, if we are working with a client, if they have chosen to continue to work with us once they're moving into housing, our caseworkers are authorized to be listed as, a secondary optional contact that would be contacted when the time for recertification comes. And we always kind of put our agency on the application if the applicant will allow it, so that if there's any issues, those providers will come back. But again, it's up to the client to come to us, and then we build relationship with those providers so that they know we're there to support 6 months later, a year later. In our office, once again, we're nestled within a legal aid. So our caseworkers actually do know the basics of how to request a reasonable accommodation or a request for modification. But we also have direct access to attorneys and can refer to attorneys when needed if that's not appropriately addressed with just advocacy on the client or with the caseworker.
Thank you.
Thank you. And
Peter,
one more.
Oh, sorry, Peter, I'm just flagging, we're pretty short on time. Any quick response?
I'll be really quick, and I really appreciate this. I also wanted to ask about when sheltering was mentioned, and I wanted to know how folks work with the people who may need support with activities of daily living and may need personal care assistance. How does that work in the shelter? Because I know that's a barrier for many folks across the state.
I'm happy to jump in. I mean,
Why
this
don't
is.
you jump in there and then we'll wrap it up after you respond. Thank you.
Yeah, Peter, I mean, this has been a huge gap where we discovered within the shelter system that there was no in-home support services. So we've been working with the county, actually reviewing California law from 2019. And so now we do have a pilot with the county where their in-home support services team will be providing services at our non-congregate shelter that is for ages 55 and above. But the goal from that pilot is then to be able to expand the in-home support services across the shelters and even look at potentially best practices in terms of caregivers and potentially having a dedicated caregiver or caregivers to different shelters, because we know that has also been a barrier.
Thank you very much, and I appreciate the committee's indulgence.
Well, we appreciate you, Peter, and what an amazing panel. And thank you all so much. It's been extremely illuminating, and I think this is just the beginning of the conversation. I also want to thank our partners at the Business Consumer Services and Housing Agency. Thank you, Tawny, for being here, for your great questions. A big thank you to Melinda Forsty and Hannah Brady, who really, I think, helped us think through this very critically and elevate a lot of questions for consideration. So more to come on that. Look forward to hearing from Marty Onoto and the Housing Subcommittee as well as our other Transportation Subcommittee. I'm going to turn it over now to Carol DeAndreas, who will walk us through public comment. Thank you.
Hello and thank you. We are now moving into our public comment period. If you would like to make a public comment, attendees joining in the webinar may use the Q&A function to type your question. You also can use the raised icon and we will call on you there. If you are joining by phone, please press *9 on your dial pad to raise your hand and we will unmute you and announce your last 4 digits of your phone line. So just a reminder, we have reserved 2 minutes per comment. So I am looking for any raised hands and do not see them. I'm not seeing any public comment.
Okay, well, we'll give it a few more seconds here, and if we don't, then maybe we can roll into break.
We do.
Oh,
Sheila. Go ahead.
Yeah,
Sheila, I'm sorry, pardon me.
that's okay. This is Shella Komindu Mong, and I am a family member, a mom of someone who receives regional center services. I'm also the executive director of Chance Housing and on the developmental services task force and on the housing subcommittee of the Disability and Agency Community Living Committee. And I just wanted to express my thanks for such a great, robust conversation, even that was happening in chat. Pretty much all of my questions and comments I put in the chat, so you have a record of that. But I did want to address the shallow subsidy issue because during lean times with the local housing authorities in my service area, the shallow subsidies were the first thing to go. Those people who had Section 8 vouchers, who were receiving a shallow subsidy. I mean, and this is different than the shallow subsidies obviously being funded by the private donations and some of the other programs that were talked about earlier. But it was the first thing that was to go with the housing authorities. So maybe in terms of the BHCS that is on the line and in charge of HCD, and then trickling on down to our housing authorities, not eliminating the shallow subsidies for people who receive housing choice vouchers and other kind of subsidies would be a helpful policy to implement in the state of California. Thanks very much.
Thank you. I am not seeing any more raised hands or questions in or comments in the chat. We are scheduled to go on break after public comment. Barbara, go ahead.
Thank you. Hi, I'm Barb Hanna, and I represent home and community-based organizations with CASA. My comment is, and the housing pieces were absolutely wonderful, but I want to just bring up another piece that I would like for us to explore at another point in time, perhaps. There's something called the data exchange that's currently going on, and it truly is more of a medical focus where hospitals, acute hospitals, skilled nursing facilities, otherwise known as SNFs, assisted living waiver program people, otherwise known as residential care. Well, actually, those groups, the ALWP is not included in this. And what I'm thinking about is to have interactivity, a place to go to share information, because today we talked about people operating in silos, and we're sharing information as we make referrals to one another. But how wonderful would it be, which I think really supports the CalAIM components of looking at the social determinants of healthcare, of transportation and housing and food insecurities as part of the medical record, so that people can see the barriers and the supports that are being done. And that system is in the process of being built out right now. But when I went to that group meeting, no home and community-based agencies were even thought about. I posed the question, I said, where are And I even just said home health agencies and hospices, because those are two considered facilities in the state of California. They were not part of the people at the table. And I just said, well, you know, where things are happening is in the community, and where people prefer to be is in the community. And you guys are all sharing information about how to get your next lab work, your next medical appointment, getting to the doctor's office, those kinds of things, but you're not including the people that are doing the work. So I'd like to just throw out for a future topic is, you know, data exchanges, and it relates at the level of the home and community-based groups that are all sitting at this table. So thank you.
Thank you. We have a raised hand. Connie Arnold, go ahead.
Yes, I don't know who the last speaker was. I didn't see or catch who was speaking, but I agree 100% with them. One of the things that President Biden has pushed forth is an 80-20 perspective for home and community-based services for a rebalancing of the fiscal calculations so that the direct support workers are the ones that are getting the care and 20% only going for administration. And what's happened too consistently is that whether it's managed care, nursing homes, assisted living, home health care agencies, they're all chasing the dollars, looking at how much they can squeeze out for profit and not putting into the direct care workforce. All of us recipients on IHSS and waiver personal care services as an alternative, we cannot find providers. And I think it's kind of ironic that SB 585, a Durazo bill passed for wages to be $25 an hour in facilities. And that shows the institutional bias, while AB 1672, I think it was, Laney, was to allow a non-transparent negotiation of wages between the state and counties for IHSS, which is a predominant population made up of family member providers. The problem we have is we need to address the bias in institutional pay and incentives between home and community-based services and institutional settings. I'm on the verge of, if my parents die, I'm going to a nursing home, or worse, I won't even think of what I will do because I won't go. I will not go.
Okay.
Plain and simple. My friends, quadriplegics, they say the same thing. They won't say what they're going to do. I won't say what I'm going to do, but we won't go. We want to be in our homes. We have a right under the Olmstead. This is the Olmstead Committee. You can't tell me that the state doesn't have the money for it. We spend $114 billion a year on LTSS.
Connie,
So
thank you so much for your comments. We need to move on to our break, and then we will reconvene the meeting, okay?
and I hope you will bring up that issue like the last speaker and talk about how you're going to redesign these programs so that they'll work for people who have disabilities.
Thank you.
Thank you.
Okay, we're going to move on, conclude our public comment time. We had slotted 15 minutes for break, but since we're running behind, we're going to do 10 minutes. It is 11:48. So we will reconvene in 10 minutes time, which is a little afternoon, right? 12:02. Okay, so
Let's just come back at noon. That gives everybody.
how about let's come back at noon, please?
We'll be back at noon because we're behind. Thank you.
Okay, thank you very much. So a small break. We'll see you back here at 12 noon. Thank you.
Okay, I think we're gonna get started. How do you want to welcome us back, or?
I would be happy to, if people can come join us. We're going to get started on our next panel. And we are ready to start on Home and Community-Based Services Statewide Transition Plan and Gap Analysis. I know many of you attended yesterday's great presentation, but today we have Courtney Maslin from Integrated Systems of Care Division Chief at the Department of Healthcare Services, Sarah Steenhausen, and Tanya Batista, Policy Chief at okay, help me out with this, Division of Policy, Research, and Equity. Have I got that? At California Department of Aging. Marty, I'm working on it. And Hagar Dickman, who is my colleague, a senior health attorney at Justice and Aging. We're really looking forward to this rich presentation, and I will turn it over.
Great. Well, thank you so much. I think that Courtney Maslin, you're gonna start speaking by speaking to the update on the statewide transition plan, and then we will transition into a very high level update on the home and community-based services gap analysis efforts. So thank you for being here, Courtney.
Thank you for having us. So just wanted to give a quick update on our statewide transition plan. We were here in February and we've made quite a bit of progress on this at this front. We in March submitted the statewide transition plan to the Center for Medicare and Medicaid Services for review and approval. We have been in constant communication with them, making adjustments as needed and responding to their inquiries. Additionally, we've been continuing to work with our providers through our remediation processes and heightened scrutiny processes. Some updates through the remediation efforts is we have started our on-site verification of the home and community-based services final rule settings, really ensuring that they're being effectuated and continuing to be effectuated. We are on a March to March audit cycle. And so that's where the team here at DHCS goes out and verifies they're actually being implemented and that they're being maintained. And so that's been a really great way to make sure that not just that they have implemented it up front, but being able to continue that constant oversight over them to ensure that they're meeting those final rule requirements. And then also, just this week, the Center for Medicare and Medicaid Services is out in California looking at some of our heightened scrutiny providers, which really this process is a process in which CMS looks at certain providers here in the state. They're looking at both Department of Developmental Services and DHCS service providers and ensuring that they're meeting the final rule requirements. This is not an audit, but rather an opportunity for CMS to see how it's being effectuated in other states. They have done these visits in other states throughout the country. We are one of the last states that they're visiting, but it is a process in which they will give us feedback as well as really ensuring that it's being effectuated in the way they intended. We are continuing to provide technical assistance to a lot of the providers when they have questions, concerns, and it also is built into our enrollment process for any new assisted living facilities, congregate living health facilities, as well as adult residential facilities. Unfortunately, due to timing constraints, we weren't able to have the Department of Developmental Services be able to attend, but more than happy to, if there's any comments, get them over to them, as well as we have our inbox in which if there's anything that needs to be raised, flag, I can pop the inbox in the chat where my team will be able to take any issues that you're seeing or if there's any things we should be looking at in closer detail. Additionally, we're really continuing to work on making this information available to you all in some way, shape, or form. And so really understanding that this is something you're all really looking to hear updates from us on, continuing to engage with you, as well as really learning where we should be spending most of our efforts on that front. And then I'll just do, I think, Sarah, I don't know if you want to start off with the gap analysis and then I'll join in after that.
Oh, sure. I guess we can move on to the next slide. We're moving on to the next issue, which is the home and community-based services gap analysis. Just a high level update. First, I would love to introduce you all. If you haven't met Tanya Bautista, she's our policy chief at the Division of Policy Research and Equity, has a great background, spent a lot of time at the Department of Social Services prior to coming to CDA, where she operated our Supportive Services Bureau. And then it is now one of our leads on the home and community-based services gap analysis project. Many of you participated yesterday in the meeting that we had with our MPA stakeholder, Master Plan for Aging Stakeholder Advisory Committee. See, Marty, I just caught myself, where we did a more in-depth discussion with all of you on the status of the home and community-based services gap analysis and how the work that CDA is, the Department of Aging is doing compared to the work that Department of Healthcare Services is leading. So just as a very high level overview, this is a project that the state is working on to understand where the gaps in the service delivery is across our home and community-based services infrastructure. So that includes both Medi-Cal and non-Medi-Cal home and community-based services. We are at the early stages of working on this gap analysis, which spans many departments. This is not just Department of Aging and Department of Healthcare Services. And the process will entail a gap analysis on our part of the non-Medi-Cal home and community-based services. And then the second phase will entail development of a roadmap to build out our infrastructure and meet the service needs on a statewide basis. So I want to turn it over to Courtney at Department of Healthcare Services for her to give a update as well. But I think it's fair to say that this is just the beginning, a lot of opportunity for stakeholder input, and there will be another public meeting in July on the 14th of July. So more information to come on that. So Courtney.
Thanks, Sarah. I think one of the things that I really want to highlight, since many of you probably were able to join yesterday, and if you weren't, we will be able to provide the meeting material shortly, is really just focusing on some of the work that we're doing here at DHCS to really engage with the consumers. So we're going to be really partnering with a partner just to help with the coordination, but we're going to be doing listening sessions throughout the state in this first year of the DHCS gap analysis. So we've narrowed it down to some locations, some populations, and some languages, and just really want to highlight those efforts. More to come. This is still, in somewhat of the planning and gathering stages, but based on our understanding, we're going to be doing it in Northern California, both in San Francisco and San Joaquin counties. We're going to be looking at Central California as well, in Gilroy and Fresno, and Southern California in LA County and Imperial County. We're going to be looking at populations that are both Medi-Cal and non-Medi-Cal, just to be able to understand the gaps in need when it comes to both populations, and really looking to have these also in multiple languages. So we're going to be starting with English, Spanish, and Mandarin at first, and really tying those locations to the languages being offered, but really looking forward to the engagement and really engaging with the consumers, I think is one of the things that we need to begin doing, and it's something we're committed to. So just wanted to give you more on that. We'll be, of course, sending out more specific details during the year, when they're going to be occurring, and how you can register and also be a part of it. And so this will be, we will allow for, caregivers and others to come, but really focused on not providers, but really the families and the consumers themselves. So looking forward to working with you all on that, and our consulting group will be kind of spearheading that as well. And so you might see some correspondence from them and from the department here.
Wonderful. Thank you so much, Courtney. And I'm mindful of the fact that we don't have a lot of time, and we really want to have time for questions and answers from all of you. But before we move into committee question and answer, we have a reactor panel of one. I am happy to introduce Hagar Dickman, who is a senior health attorney at Justice and Aging, and will provide a few comments in relation to these efforts, both the gap analysis as well as the statewide transition plan. And then we will turn it over to our committee members for Q&A. So Hagar, welcome.
Yeah, thanks for having me. I just thought I would join and just give a little bit of context. I've been at Justice and Aging for the past year, looking at equity issues in California's home and community-based services. And it's really given me an opportunity to look at and test out all of the different data that's coming out of the state and Department of Social Services. And I wanted to kind of put a framework around what it is that when we talk about gaps in home and community-based services, what is it that we're sort of wanting to see, and then how we think that the state and this gap analysis can, what the gap analysis can use in order to answer the questions that we have about these gaps. So to really get a full picture of California's home and community-based services landscape, we need to first answer who's getting home and community-based services in California, both by demographics and by geography and by county, and then also by need. What are the needs of the people that are currently getting these services? And then we are left with who is really being left out of, and that's how we get to the question of the gap. So who is not receiving services at all, who are receiving some services but have limited options as to what those services are. And then who is receiving services that are not fulfilling those needs? So who has unmet needs in that group of people that are accessing these services? And then finally, we also would like to know whether the services that people are currently accessing are actually adequate. So identifying who has unmet needs and why, where providers are in relations to recipients, because we all know that California is experiencing severe shortages in providers, and we want to know where those providers are located and where recipients are located, so that we could, excuse the noise here in the background, so that we could work towards or target investments in providers to ensure that recipients around the states are accessing care. And then looking at health outcomes. So what are the health outcomes of particular communities by demographics and by programs to identify gaps specifically related to those programs. And if you can go to the next slide. I'm sorry about the noise. So to really get this full picture, we want to have some data to be able to kind of have that analysis. So we want to first have a baseline number of who are the eligible populations around the state, what are their demographics, where they are located, and then be able to identify them by potentially diagnosis, dementia, mental health care, mental health needs, developmental disabilities, etc. So these are people that could potentially access or should be accessing home and community-based services, and then compare those with the individuals that are actually authorized to receive services, and then again with who among those authorized individuals is actually utilizing services. And the reason that's important is that in order to identify gaps, we need to know who needs the services, who's authorized for them, and who's able to access to, so that we could pinpoint where gaps are happening specifically. Are they happening in access? Are they happening in awareness? And are they happening in actual utilization? We want to have a comprehensive demographic picture. So one of the things that's been missing from a lot of the demographic data has been sexual orientation and gender identity as a category. We'd like to see multi-level stratification, which means that we should be able to look at intersectionality in access. So how are different demographic factors changing or affecting access to care? And then we also want to see quality measures that actually reflect service quality and health outcomes beyond just administration. So how are particular services affecting people's health and ability to live in the community? So I'll end there and could answer questions.
Thank you so much for those reflections, Sagar. I think it can help inform the discussion. So maybe Tanya, or sorry, Jackie, yeah, perfect, you did it. We're all in gallery mode now. So now happy to have about 10 minutes for questions or comments from any of the committee members on the HCBS gap analysis or the HCS update on the statewide transition plan. We had a great discussion with all of you yesterday. Oh, there's Patty. Thank you, Patty.
Thank you. So thank you, Courtney, for that update. That was really helpful on the HCBS settings rule. And many people on this committee participated in earlier stakeholder engagement and also provided you with written comments. And one of the overriding comments was that there was really a need for an ongoing work group, a stakeholder work group to be participating with DHCS and DDS regarding how the settings rule was being implemented following the March 17th implementation date or compliance date. And I think particularly because the state has engaged in a transition plan, a compliance plan to come into full compliance. We know that it's still a work in progress. And we would ask again that ongoing work group be available so that you can be hearing directly, not just through your info portal, but in a meeting form about what people's concerns and observations are as it rolls out.
Thank you, Patty. We'll definitely take that into consideration. I think one of the things that will really be kind of a point for us is really having the feedback from CMS on our statewide transition plan, and as well as these observations that we have received from CMS after their heightened scrutiny visits, right? So I know Joseph Billingsley, who is the Assistant Deputy Director, is attending those CMS on-sites. I think he has one tomorrow. So I think that'll be kind of a good way for us to re-engage on this effort after that, and really understand how they're seeing, because they can give us the perspective of how other states have fully implemented. They're not quite as large as California, but what were their successes, and what things did they struggle with? I think the other thing that's been really helpful that I kind of want to have mature a little bit more is that auditing process, right? And really ensuring that a few months later that it's still occurring and right, that they're still receiving the benefits of the HCBS setting rules put into place. So I think that would be a great kind of touch point after that. So I think that's something we can take back. I don't want to speak for our GDS colleagues on the call, but I do appreciate that consideration, as well as I think it would be good to have those few things in place for that kind of more meaningful engagement. And I don't know if Joe, if you want to add anything, since you're the one with going with CMS.
Yeah, no, thanks, Courtney. Can everybody hear me? Okay, perfect. Yeah, just adding in that, yes, we are currently going through that process with CMS. I went on one of the site visits yesterday, and I'm going on another one tomorrow down in Southern California. I think also, just to tie back to your point, Patty, and what Courtney was saying, as we continue to move through this process and finalize responding to CMS questions and feedback related to the statewide transition plan that we submitted back in March, and then completing the heightened scrutiny review process, is that we have committed to and will continue to being committed to at minimum utilizing this DACLAC committee meeting process to include this as a standing agenda item as the DACLAC committee determines to continue doing so, and are fully available to come and provide updates on the process, where we're at, and being able to provide updates related to the statewide transition plan being finalized, the heightened scrutiny process, the ongoing audit process, and work that we're doing to ensure that providers are coming fully into compliance with the HCBS settings rule requirements.
Thank you, Joseph. We have a question or comment from Barbara Hanna.
Thank you. I just want to reiterate that the far north rural geographic areas were constantly left out. We have families that are being broken apart because they have to move their loved one that needs, let's say, assisted living waiver program services to Southern Cal or to the middle of the state, which to me is Sacramento. And this is true also, Robert had mentioned, over on the coast and the areas above Santa Rosa North. It's those same geographic areas that are isolated by mountains and weather, etc. So I really feel like you guys need to be present in those geographic areas, and we need to expand our services so that it's truly a statewide program throughout the state.
Thank you.
So thank you.
I think that really speaks to the need of the home and community-based services gap analysis. It absolutely is an analysis of all of the state, including and especially our rural areas with a focus on equity and underserved populations. So we appreciate that input. Marty, you're up next, and then we're going to move on to our Housing and Transportation Subcommittee report.
Thank you, Marty Emoto, family member. First of all, I just want to thank the teams from California Department of Aging. I was just saw Patty's looking at me, and also the Department of Healthcare Services. Joseph Billingsley, and for the work you did yesterday. That was a very good presentation, and the work you all are doing could be, if it's done right, very foundational for further transforming change. I did want to say, so I'm referring to the gap analysis at this point, but if you can also look at possibly, because it wasn't mentioned, about looking at other ways to measure the potential gaps. So that's looking at the new measurements that are in place in different systems that are just being initiated either last year or this year. For instance, on the Department of Developmental Services is initiating several new ways of measuring, and I think some other departments, Medi-Cal is too as well. I would also suggest looking at data from the various ombudsperson's offices and all the different departments, fair hearings, to see the types of complaints or problems that are emerging that way as another source of data. And lastly, I would really urge the two departments, when you're talking about this, to really emphasize how different this analysis is from everything else, because a lot of us who have been active in, whether locally or statewide, we've been through studies and things before, and people might just put it off as another thing to keep people busy. But this potentially has meaningful outcomes for individuals. And I think you tie it back to why this is so different, because it goes back to the individual. And I think you guys really need to emphasize that this is different and how important this is for everyone, not just to the state, not just for policymakers, but for the individuals who aren't getting the services they need, and to the providers who are understaffed and all that. So, and also you may want to underscore again who the gap analysis is addressing. So there's the Medi-Cal and non-Medi-Cal. It's for older, it's 18 years, people 18 years and older, and that was underscored yesterday. So that it does include regional center people who fall in that category, and others who may not qualify for Medi-Cal. So you're doing great work. I just want to do everything I can to support whatever you're doing with this, because it's foundational. Thank you.
Thank you, Marty. We appreciate your input very much. And we will look forward to the next update and engagement with all of you on the gap analysis. And appreciate the Department of Healthcare Services being here as well to report out on these things. If there's no other questions, I think we can move on to the next agenda item. We're really pleased and really appreciative of the wonderful work of both our transportation subcommittee, which is chaired by Michelle Rousey. Thank you, Michelle. And the housing subcommittee chaired by Marty Emoto. So we will turn to both of you for your updates and then questions from the committee members. So Michelle, you are up first. Thank you.
Thank you. And thank you for letting me present today. Hello, everybody. My name is Michelle Rousey. I'm the chair of the Transportation Subcommittee, and I'm a wheelchair user, and I have multiple disabilities and rely on accessible transportation and environmental accessibility to get around. Next slide, please. Before diving into the nitty-gritty, the first principle driving the work of our subcommittee is that we want to imagine a world where everybody can get where they need to and want to go when they need to and want to get there. As you see with this quote, we want to begin with the end in mind. Next slide, please. Slide 3. In our goal, we orient the transit networks and transportation providers, policymakers, and administration around the needs of all riders. We've hosted a plethora of focus groups comprised of people with disabilities and older adults who utilize accessible transportation and whose transportation needs are not being met. Our overarching goal has been to better understand their varied transportation needs and how existing systems can be improved and new systems created to better accommodate them by working with local nonprofit organizations, policymakers, and transportation providers and statewide agencies. We want to ensure the voices of people with accessibility needs are being met with each and every level. Next slide, please. Give me a second to catch up. There we go. Our heavily car-dependent transportation system simply doesn't work for a lot of folks, including older adults and people with disabilities. We know there is a need to improve paratransit, fixed route bus and rail lines, and improve walk and rollability. And there's also an entire universe of accessible options and coordination that must be funded. Our current patchwork of transportation leaves many older adults and people with disabilities with infrequent and spotty services operations, and vehicles that don't meet the needs of people with disabilities and seniors, and high financial costs for paratransit services. The Master Plan on Aging in 2023 and 24 goals recognizes the needs to integrate accessible transportation into a more seamless and effective system that meets the needs of riders. Consolidated Transportation Services Agencies, the CTSAs, are identified as one of the best avenues of implementing these changes, but they would need to be expanded, empowered, and better funded. Next slide, please. As a subcommittee, we have providing information to members regarding potential CTSA improvement mechanisms, and one of which being Assembly Member Witt's AB 540. Due to the range of organizational and funding reasons, the accessible transportation funding services in the state do not meet the mobility needs of older adults and people with disabilities. And this slide outlines AB 540 modernizes the 1979 Social Services Transportation Improvement Act through certain and local coordination agencies, and establishes a dedicated funding stream for standing up to these agencies and funding them ongoing. The current status is it has been turned into two-year bill due to the transit fiscal cliff, and allowing a greater time to coordinate, build, and educate. Assembly Member Wick's staff has requested support from the Legislation Analyst Office related to the estimated cost and potential revenue sources. Next slide, please. And now, all of you, we need is you. All we need is you guys. We need an ongoing pass the baton to Debbie, as we previously subcommittee chair of the Transportation Committee for DACLEC, and talk to you a little more about who joins us and who would like to join us. Debbie?
Thank you, Michelle. I love having you on board, and happy Pride, everybody. As the recovering chair of the Transportation Subcommittee, I want to thank Michelle for taking the reins. It's very important in our work that we include leadership and voices of people with lived experience, not just those of us who serve populations like folks with Alzheimer's and disability and other aging and disability related issues. So I really, truly appreciate you taking the reins. So we want you, and I'm talking to all of you, to join our subcommittee. The meetings are on the second Tuesday of each month, as you can see on the slide here. And I am putting the link in the chat now too, so you can click on the link and join our meetings. Thanks to the California Department of Aging and Jackie and Amanda and all the folks at the California Department of Aging for hosting the meetings, setting up the meetings, and doing all the heavy lifting behind the scenes. So as you can see, the structure of the meeting is we have one presentation, and this we learned over time because our meetings were so packed and we didn't have any time to talk. So we agreed as a group, we're going to have one presentation We're going to have one education opportunity for advocacy, and then we're going to have some open dialogue so that we have time to extract knowledge. So we feel incredibly fortunate to have regular participation from writers, from nonprofit service providers, from transportation planners, from California senior legislators, from Caltrans team members, from the California Commission on Transportation, from the legislative policy staff, independent living centers, and that's not a comprehensive list. That's just a sampling of the people who are attending. We have over 100 different people and entities that are on this distribution list that have attended a meeting, that participate in our work, and it's amazing. But we still need more. I feel like we're underrepresented when it comes to people with intellectual and developmental disabilities. Some other disabilities, I'm thinking about the deaf community. We all in this room and space know that aging and disability are continuums, and we need to ensure that all the voices are at the table. So as we dream of this incredible new system where people can get where they want to go when they want to get there, that we have all the voices shaping that system. So I just invite you to please come and please be a part of true systemic change in the way that we provide transportation in California. Thank you.
Who do we need? We need all of you to pass the word and to come join the subcommittee on the second Tuesdays. Thank you, everybody. Thank you, Debbie.
Thank you.
Thank you so much to the dynamic duo of the Transportation Subcommittee. We're now going to turn to Marty Emoto, who's going to present for the Housing Subcommittee. And then at the end of Marty's presentation, we will then take stakeholder comment and then public comment. So I'm going to ask, I see somebody has a question. We're just going to hold the questions till after Marty goes. Okay, Marty, take it away.
Thank you, Patty. And thanks to my old friend, Michelle. We go back, and Debbie, for that matter, we go back 25 years, right? And now we're totally qualified for being called older adults now. My name is Marty Emoto. As I mentioned before, I'm a sibling of a person with developmental disability. She passed away 20 years ago, and a parent of an adult 30 years old. He'll be 31 this month with Down syndrome and autism spectrum disorders and some behavioral health needs, and who lives with me. And I'm presenting this overview, and the subcommittee members feel free to jump in and add to anything I might have missed, or to provide further detail if needed. I'm presenting some pictures and some additional material with the subcommittee report. And the reason I'm doing that, and I'm not even asking the permission of the committee to do it, it is because as an advocate, I feel my role as a family member and as a parent to constantly remind ourselves, that's me, myself, and everyone else, of why we're here and the importance of why we're here. This piece of art actually is called Labeled Person. It was actually made by a person with developmental disabilities. She attends an art program in Santa Cruz. Her art piece, along with 70 others, were actually part of a several month-long exhibit at the California State Museum that we organized. It was the first ever exhibit devoted by artists with people with developmental disabilities ever in the history of the California State Museum. And that was one of the pieces that was presented, labeled persons. And I think it speaks to how we have to overcome the barriers of people who are labeled in different systems, people who are labeled as older adults, but not thought of that they could have disabilities or mental health needs and behavioral health needs, or people with disabilities who aren't necessarily thought of that there's older adults within that community, or people with behavioral health needs. And we're going to have to constantly remind ourselves that even as good guys, we're the good guys, right? We label each other inadvertently, and we're going to have to overcome that. Next slide. I hope there's a next slide. Again, this is a reminder of why we're here. The pictures of the two women is Elaine Wilson in the pink or the red or Raspberry, and the other woman is Lois Curtis. They're the two individuals who filed, two women from the state of Georgia who filed what became known as the Olmstead decision, the original lawsuit, the federal lawsuit. They were people with developmental disabilities, people with mental health needs. They were institutionalized, and they, together with the legal counsel that they had, prevailed in what came known as the Olmstead decision. Olmstead is actually named after the Health and Human Services Commissioner of the state of Georgia. But I want to mention their names because it's just so important that we don't forget why we're here, and that what they fought for was about their lives. And the next picture over is me introducing and then speaking with Lois Curtis when she appeared at the state capitol about 10 years ago in front of 1,500 people. I knew both Lois and Elaine. Elaine died in 2005 and Lois just died in November. And I just want us to remember that it was about two individuals who did not want to be institutionalized, which is why we're here. Next slide. Again, another reason why we're here. This is Shirley Klein. Actually, she wrote this poem in 1990. That's a mistake. And she wrote it. She had developmental disabilities, physical disabilities. She used a wheelchair. And she wrote this poem. I won't read this one. I'll read the final one. But I want people to know that this is how she felt when the Americans with Disabilities Act was signed and her father died the next day. She wanted me to make sure that the poems that she wrote, and she wrote some for our protest rallies, and they were actually read in front of 6,000 people in the state capitol, that she wouldn't be forgotten. She died about 10 years ago. I went to her burial up in Grass Valley, where she eventually moved. I want you to also know, and Sarah, you might remember her, she did attend some of the early, what was then known as the Olmstead Advisory Committee meetings when they were held at the Secretary of State's offices, and I was with her. And going back to the issue of transportation, Debbie and Michelle, after the meeting, we were waiting for her paratransit bus that never arrived. And so it was 4 o'clock and it was just me and her. And we ended up waiting till almost 9 p.m., just me and her, for her ride to eventually show up. And so that was at an Olmstead meeting and she had a transportation need. Next slide. Actually, Lydia was at that meeting too, actually, now that I think about it. The issues that we touched on in recent months during the time of the last meeting, and I want to thank, I think the subcommittee definitely wants to thank the California Department of Aging, led by Sarah and also Ross and the others. I'll actually list out the names. They provided, and thank you, Sarah, for actually raising the need for members of the Housing Subcommittee to raise the parts of the master plan for aging, but also the gap analysis in terms of where housing services should be addressed. Really appreciate the fact that you were really good about pushing for that. These two topics were the main focus of a subcommittee meeting where subcommittee members offered up ideas, suggestions on regarding the key outcome measures for the master plan for aging as it referred to housing, and also on the gap analysis as it referred to housing as well. And what's remarkable about that is normally in the past in our work, housing and the services related to placing people in housing at the local level, the kind of work that Melinda and Hannah do, and also Shella, who's also on our subcommittee, are often forgotten in terms of HCBS type services. And the fact that Sarah and other people with the department really pushed to have that included, I think shows how foundational the gap analysis and also the master plan can be and will be. Next slide. More recently, and this kind of ties back to Patty and the panel that you put together on what local agencies are doing. So that the agenda topic earlier today with Melinda and Hannah. This was a subcommittee meeting held on May 23rd that focused in on the partnerships in the local level, in this case, Santa Barbara County, with the Housing Authority of Santa Barbara County and a community-based organization similar to Hannah's organization that actually places people, does assessments for people with disabilities, developmental disabilities, people with mental health needs, and older adults in Santa Barbara. And we discussed all this in terms of priorities, whole person-centered housing needs in the home and community-based services gap analysis, and also the master plan. And really appreciate, again, the Housing Authority of Santa Barbara County for the executive director for participating, and also Sheila DeMong, who's a family member and also the executive director of that housing organization in Santa Barbara. And again, appreciate the subcommittee for really offering up really good ideas on how to work together. Go ahead, next slide. And just you can read this later. It's just events that occurred that dealt with issues of housing, either as part of the revised budget by the governor on May 12th, May 15th, the California Business Consumer Services and Housing Agencies held a webinar focused solely on the housing proposals in the May revise on May 15th. Next slide. Also in May was the All Inside Initiative that was launched by the White House and the U.S. Interagency Council on Homelessness. Couple people from California were part of that launch. And again, you can read this to get more details about it. But it was really important that the California Business Consumer Services and Housing Secretary, Castro Ramirez, was a part of that launch in May. One thing I don't have here is it was a webinar that was held on April 6th, and my hat goes off to, I don't wear a hat, but kudos to Debbie Toth and her group, the East Bay Leadership Council Series Ending Chronic Homelessness webinar, and it was sponsored by the Choice in Aging, and it featured Roseanne Haggerty of the Community Solutions based in New York. And some members of the subcommittee did attend that. And what I took away from that was the key importance and foundation of community partnerships and data working together to help end and prevent homelessness and to really push for person-centered housing. So I really appreciate that webinar that you held, Debbie, and hope there'll be more like it. And lastly, there's a LA Times article. I put a link in the chat regarding some renters dominate California, but they're struggling to survive. Next slide. I think it's the last one. Oh, I forgot that there was an interagency council on homelessness held, the quarterly meeting on May 31st. And you can read the description that I put down there. And I also appreciate the fact that Susan DeMorris was on that webinar and actually I thought was really good about talking about the issues of homelessness and preventing homelessness impacting older adults, but also people with disabilities. Next slide. Lastly, this is again the poem that Shirley Klein wrote. She wrote it in 1983. I'm going to read this, and I don't care if it takes too much time, frankly, okay? Because she is a friend, she was an advocate. She had to wait for like 6 hours, 5 hours for transportation. So Debbie, that's what we're going to fix, right, Michelle? But I promised her that I would not let her voice be forgotten and her face be forgotten. And that's why we're here. So if it takes a minute that goes beyond the time of the agenda, so be it. And she called this, and I think this is really important about capturing the issue of whole person-centered needs and outcomes. And it's about the individual who needs help. The clients, they talk about us and confer, squeezing our dreams into little boxes through sterile pins that never aspire beyond the lines or dotted I's. Sitting there whole, they discuss and describe and define our brokenness. Assured of their tomorrows, they map out are today's as tokens for our submission to the future they have decreed for us. I think that speaks of a system and changes that we've made over the years, and something that we want to avoid and work towards whole person centered needs and advocacy. I think that's the end, isn't it? Yeah.
Thank you so much, Marty. And that was a perfect ending to ground our work in remembering why we do all of this data and policy advocacy and talking about things when somebody can put into a poem the underlying feeling that has robbed people of humanity, and that's not acceptable. And we are here to lift those voices. So thank you so much. And yes, you ran over your time, and we totally expected you to do that, Marty. Let's see. I want to make sure we have a little bit of time, though, to take committee member comments and questions. So I'm going to open it up for that right now. If you could just raise your hand, I'll call on you. Okay, I'm not in the full mode, so I hope I'm seeing everybody, but I'm not seeing any hands raised. So I will then open it up to public comment. And oh, let me just, before I do that, say that you can raise your hand if you want to comment on either the work of the fabulous transportation subcommittee or the incredible housing subcommittee. So yeah, you can address either one. So let me give you one more minute. Okay, then I'm going to open it to public comment, and I'm going to turn it to Carol to
It looks like
facilitate
we have
that.
Peter and Lydia have raised their hand.
Oh, I'm sorry. I'm not seeing them for some reason. I must be in the wrong view. Thank you. So Peter.
Okay, I want to clarify we can just speak under committee comments. So should I wait? I don't want to
You are a member of DACLEC, Peter, correct?
Okay, I just wasn't sure.
This is your moment. This is your
comment or
opportunity.
committee comment. First of all, I want to really thank everyone for the great presentation and dialogue we had today. I appreciate all the efforts that we're working collectively to improve lives of people with disabilities and older adults. And just to say that housing and transportation, along with in-home support services and all the LTSS programs that support our valued community members staying in the community, really need to work together. There's major gaps in transportation in rural areas. Sometimes services don't connect together. If one part of the system, whether it's transportation, housing, or LTSS services fall apart, and one day that can be really disruptive to people's lives. Couple of comments I wanted to make. One of the reasons we're here is to help people stay out of institutions and to live their best life in their community throughout the lifespan. I'm still hearing reports and seeing emails about people having to stay in bed and wait for home care support. People attempting to use the backup services in their various counties and not really being able to do so. Last Sunday, as myself, I received a phone call from a community member who was trying to support someone who was discharged from a facility on Sunday. And apparently they had housing arranged, but the housing wasn't accessible. They also, my understanding is that there was no provision for home care and home support services. They asked if I could take that person or have that person come to my house temporarily until they could find a better setting. I'm not really set up to do that right now. It's kind of a medium goal that I have, but this person had nowhere to go and I believe had to be transported back to a hospital. We need to have better ways of dealing with transitions that are unexpected, or when an agency doesn't follow the process to make sure organizations are notified when somebody needs support around transition. You know, we've lost several people in our community lately. One of the people we lost was Blaine Beckwith, who many of you know because he was very active in long-term services and supports, and transportation, and many other issues. Blaine, as towards the end of his life, spent in some cases more than a year in bed because he couldn't get home care support. And in one case, he needed a modified back brace, and that really took over a year to have, so he was stuck in bed. What I'm talking about today is dignity. And people have the right to live their lives with dignity. And it really makes me sad, and for my friend Blaine and the other people who have had to spend time in bed or not had the services they need. Fortunately, I've been lucky. I've only had to stay in bed the most a couple of days when something happened. But this is what we need to really drill down and address so that people can access the backup services. We need to know when we can request a backup service, how to request, what's the accountability to make sure that when the backup service is supposed to respond, that they actually do. So what I'm asking for, and I realize I'll wrap it up, is maybe in a future meeting to agendize some of these topics so that we can drill down and really get to how we can deliver a better service that really has equity and really is in keeping with the principles that we hold dear. And I do appreciate your time and I honor our work, but we need to move the needle a little bit more forward. And we also need to provide a space where those people having the lived experience with its barriers have a chance to speak and give that personal perspective. Thank you.
Thank you so much, Peter, for your words and for your call to action and for a suggestion for a future agenda item, which we will take up. Lydia.
Hi, everyone. Thank you. Sorry, I had to come in late because I was dealing with a medical provider this morning. I just wanted to pull on the thread that emerged in the chat that I think is so important, and I don't know what to do with this thread. I just know it's a significant one, and that's that while we, who kind of talk in our own echo chamber sometimes, right, need to really tackle and figure out some better ways to address the persistent prevailing medical view and medical culture that's out there, even as federal and state policies are driving us for the first time in my 30+ career, really strongly in home and community-based services direction. And I think until we can break that, crack that, I guess is what I'm trying to say, crack that model where it becomes natural for people in the medical community to also think about how care is delivered in a person-centered way, what happens when people are discharged, all those things we all are familiar with. I think it's going to be tough because I could tell you tons and tons of stories about how the community we serve in home and in the community, our CBAS programs and our adult day programs struggle with this every single day. So I don't know what to do with that comment other than I think it's something that we talk a lot about, and it's something maybe that's deserving a little bit of discussion at some point in time. So I hope some other folks have thoughts on that. And that's all I have to say for right now, but fantastic meeting. I'm glad I got to join for the second half. Thanks, everybody.
Thank you, Lydia. And we're going to take Claire as our last question. So we leave a little bit of time for public comment, but take it away, Claire.
Thanks, Patty. And Claire Ramsey again from CDSS. And I just want to thank everyone, both Peter and Michelle and Connie in the chats for lifting up some of the challenges you're seeing with the IHSS backup system. I think we're definitely happy to hear more feedback, understand what's working and not working. It is a new program that we are in the process of. I mean, every county has one, but whether it has enough capacity to meet the needs, whether it's succeeding on all fronts at this point, it is still very new. So we definitely want to hear the feedback. We want to hear what's working, what's not working, and have more feedback from everyone. So I'll just say, feel free to email me if there are some particular county issues you're seeing. Peter, if you want to find time, we can chat about the individual you were referencing, and I can get some more information about what happened there. But and support us putting this for another agenda item at a later meeting if that works for the committee. Thank you.
Thank you so much, Claire, and we will call on you and your expertise at a future meeting, because it sounds like having on the agenda a more in-depth conversation about the IHSS backup system, how important it is, its promise, and also some of the pain points would be really helpful. So thank you. I'm going to now open it up for public comment. If there's anyone, members of the public, either on this Zoom call or on the phone, who wants to participate, I'm going to turn it to Carol to manage that.
Thank you. This is our second public comment for the day. Just want to remind you, 2-minute allocated for each public comment. You may use your raised hand icon in Zoom, or if you're on the phone, press *9 on your dial pad and we'll call on you. So our first public comment is Connie Arnold. Go ahead, Connie. Can you unmute?
Sorry, that took me a minute to unmute. I wanted to ask a question, and I've been putting a lot of stuff in the chat, because all I can say is that the bureaucrats think they know, but really have no clue, or just don't really care about the needs of individuals with disabilities struggling to remain independent in the community, because independent living that started back in the 1970s with the San Francisco protests for 504 to get the federal legislation signed so that we could get the assistance that we needed, and anybody receiving federal assistance required to provide accessibility and inclusion for people with disabilities. And we want Olmsted. And I want to know, in terms of the transportation, how we're going to address the wildfire crisis that leaves vulnerable seniors and people with disabilities without care in emergency situations. This is a really trying situation with advanced notification for paratransit. Power goes out, phones go out, people's equipment goes out. I just want to say, this came up just this week. Somebody I knew, I considered a friend, Michael Mankin. He was the director of the what is the name of it? The Universal Design section of the Division of the State Architect. And he passed away in Sacramento. And you want to know why he passed away? He passed away because he couldn't get his breathing apparatus, his machine, his old machine fixed. And they gave him a lower level machine that would not work well for him and stopped working, and he died. That meant he suffocated. And I have friends that have been trying for 3 years to get a wheelchair cushion. They can get the approvals through the doctor, but they can't get the DME to provide it. I have a friend who's a quadriplegic in Southern California who's getting stem cell transplants for baby tissue for his butt, for his wounds, at $130,000, but he can't get a $6,000 electric bed that he needs. And he can't find caregivers. And he had services through a home health agency that would come in, sent people who refused to turn him. Who didn't.
Connie, thank you so much for your public comment. We want to allow enough time for your other colleagues on the call, and Cindy's next. So thank you so much.
Can you answer the question about the transportation?
We've noticed you've left that question in the chat, and we will get back to you on that.
All righty. Thank you.
Thank you.
Appreciate it.
Thank you. Cindy Soto, go ahead with your comment.
Okay, thank you very much. My name is Cindy Soto, and I work for Cal Life Independent Living Center in downtown LA. So my comment is about rehabilitating and building new housing. One problem is that city planners and architects, they don't seem to understand what accessible means. You'll ask them, are the units accessible? They'll say, yeah, there's only one step at the entrance. Well, how come they don't understand that one step can mean, no, we cannot use that unit? So I really feel that a more education needs to be made to city planners, architects, contractors about what really is accessible. Not only a step to get into the unit, but bathroom doorways are always very narrow. So anyway, thank you very much. That's all I have to say at the moment.
Thank you, Cindy. So Patty, no other hands are raised at this moment.
All right. Well, we finished just a few minutes late, but we sure packed a lot into this agenda and conversation. If we feel that there are sort of follow-ups that need to happen, it's because we couldn't adequately dive into all of the areas, but I think this was a really rich conversation on a number of complex topics, and I really want to thank you all for your important participation and contributions. I'll also make a final plug for joining the subcommittees, both the transportation and housing subcommittees. And if you didn't catch where in the chat to
I'll
contact
call you right back. Okay.
Marty,
Give me just a minute. I gotta finish.
somebody's got to mute. You can also contact CDA and they will give you that contact information. And then a final plug to submit your application for renewal for the DACLAC's larger committee, this committee, so that we can continue to hear from all of you and bring that richness of voices and experiences to the table. I can't thank you enough. Susan, did you want to say anything in closing?
I wanted to thank you, Patty, as our chair, and let Eric know when he watches this recording that he was missed. I also want to thank Michelle and Marty for leading our two subcommittees, and to all of our state departments. You may not know, today we were joined by state hospitals, Department of Public Health, Department of Social Services, Department of Healthcare Services, Department of Rehabilitation, Department of Developmental Services, and the Office of Emergency Services. So thank you to all of our
consumer services and housing.
And our marquee panelists. Yes. And then Marty, I wanted to thank you so much for sharing Shirley's poem and, you know, the title of Bitter Choice. I think we are all about a better choice. So thank you. Thank every one of you for your commitment to DACLAC and to older adults, people with disabilities, and family caregivers, so that everyone has a better choice. Thank you so much for joining us today. Have a good afternoon, everyone.